Welcome to the FemiNinja Project. I am your host, Cheryl I Love, middle-aged ninja hiding in plain sight, dedicated to restoring human dignity one person at a time and helping you unleash your personal power. Discover that it's possible to look like a woman, act like a lady, move like a ninja, and think like a warrior. And remember, men are always welcome on the FemiNinja Project. I have a wonderful guest with me today. Her name is Ashley Zimmerman. Hi, Ashley.
Hi, everyone.
Thank you for being here today.
Yeah.
And I feel really special that you're with me today.
Thank you.
And so for my audience, Ashley is a fellow physical therapist and also a fellow a Pilates instructor. And she's going to talk about something that is really near and dear to my heart. It's something that she specializes in, and that is pelvic health and awareness, pelvic floor health. And I think it's a subject that's kind of been taboo for a lot of years, and it's also been really misunderstood. And there's a lot of misinformation out there. Is that right, Ashley?
Yeah, that's so true. And it's when I really started on this journey, that was one of the things where I was like, first of all, people don't want to talk about it. It's still, like you said, I think it's getting better, but still a little taboo to talk about it. So honestly, I just talk about the pelvic floor.
Well, there you go. And we're going to talk a lot about it today. So you are a physical therapist, and this is your specialty, is pelvic floor health.
Yes.
And how did you come about that? How did this become your passion? So start at the beginning. You actually went through your bachelor's degree. You went through your undergrad, 4 years straight through. And then you went right from there to physical therapy school?
Yes, correct.
And at this point now, physical therapy school is actually a DPT program. So it's a doctorate of physical therapy. So think about that. It's, you go through an awful lot to become a PT. I was lucky enough just to have to get a master's degree. So you went through 7 years straight through.
I did. I know. It's a little crazy looking back. But, here I am. It's been awesome since. I did my schooling. I'm originally from North Dakota, so did all my schooling there. In my third year PT school, I took a women's health elective. I was kind of still trying to decide, okay, where do I want to be? I kind of was dabbling with the idea of maybe going into pediatrics, but didn't really know. And then I took this women's health elective and just kind of fell in love with what they were trying to do. I thought it was a little bit crazy that there wasn't very many of us in this elective class because it's pretty important and I felt like everybody should know about it. And I really thought that since I had grown up thinking that, girls can do anything, right? And girls are totally equal to men, and that's actually not really true.
Newsflash!
So surprise, right? But I totally had this mindset that like, oh yeah, women are totally equal. It's not true. Unfortunately, there's a whole lot that we can do to better the care for women. And it starts by talking about it. We have to be okay with talking about it to everyone, not just women, but men, our sons, our daughters, everybody.
Because, men have pelvic floor issues as well.
They do. They do. One of the big differences, though, is if a man has any issues with that part of their body, they wait about 7 days. Women wait 3 to 7 years. That's not okay. And it shouldn't ever be okay. And unfortunately, women are they're still told, well, you've had a baby, right? So you're never going to jump on a trampoline again. Well, that's normal. Like, you can't run without peeing your pants. Oh, you just have to live with it. You're old.
Yeah, that's my favorite. Yeah.
It's awful. It's
awful.
Terrible. It's ridiculous. It's completely ridiculous.
It's awful, it's ridiculous, and it's absolutely not true. So you're here to bust some of those myths about, okay, you've had a baby, so now every time you try and run, you're going to pee your pants. So we're talking about incontinence. We're going to talk about pelvic pain. We're going to talk about prenatal, postnatal care, and care all the way through, menopause and beyond.
Yeah.
So you're in private practice right now.
Yes.
So you opened up your own practice.
Yes.
After working for other people for how long? And how did this go about that you decided it was time to go out on your own?
So I worked in like a typical PT setting with insurance for about 5 years. 2 years ago, was when I really got into working with Pilates in conjunction with physical therapy. So that's when I started my own separate thing. Your Strength Within is what I created. So I did that because I, if I'm being truthful, insurance, I don't think should dictate how I give care. I've done the schooling. I've gone through all of that. I've gone through numerous continuing education courses, and I didn't really like listening to somebody tell me how to treat my patients.
Or what you could not do.
Correct.
How many visits.
Yes.
And what you had to address. That was one thing that really bothered me. It's like, this is the only thing you can treat. This is the only thing you can look at. And as we were talking about earlier, you got somebody was, questioning you, or it was actually, someone from the insurance company.
Yeah. So, I spent a lot of time in my first job right out of school talking with insurance adjusters. And to no fault of their own, they're doing what they're supposed to be doing, but they would question why I was working out or why I didn't exercise that appeared to be for a different body part when they were in for whatever, their right shoulder. And, a lot of it came back to like core support, pelvic stability, all of that stuff. And it, at one point you kind of want to be like, well, what do you think is holding people up? Yeah. But you have to, be maybe a little bit nicer on the phone when you're talking to them. But that's just not okay. Like, it's just not, I'm a professional, right? I'm going to evaluate. If my mom was going in and not being looked at whole body, our body is there's not separate pieces. We can't just like piece out the right arm because it's connected to you, right? It doesn't just hang out by itself. So if somebody was treating my mom or my sister or whoever like that, I mean, not the person I want to be giving them care, right? And that shouldn't be how it is. It's a whole person sitting in front of you. Just because they're feeling the pain in one part of their body doesn't necessarily mean that that's where the dysfunction is coming from. And that's how we miss so many things.
Exactly. That is beautifully said. And if somebody comes in with knee pain, it's the knee. So, everybody's focusing on the knee, the doctor, the physical therapists, everybody, the knee. But it could be something that's happening in the foot, the ankle, the hip, the neck, anything, the tilt of the head that is impacting that knee pain. So you can treat that knee until the cows come home, and it's not going to get any better. Or you might alleviate some of the symptoms, but once they go out into the world and the physical therapy is completed, whether it be from the insurance company dictating that or not, then they go out and they start doing the same things they were doing before, and bingo, here's the knee pain. Yeah,
and that's when a lot of patients or clients too just get kind of brushed off, like, well, you're as good as you're gonna get.
Oh, I hate that.
I know, like they'll say you've reached maximal medical improvement or something.
Yeah, that's it. MMI.
So, that's it. We're done.
Yeah.
Like, there's nothing else we can do for you.
Good luck to you.
Yeah.
Yeah. How's that make you feel? Well, okay, we can manage the pain. We can give you these medications. We can do all of these things that have, horrible side effects, or, you're left with no hope.
Yeah. Exactly.
Oh, it's terrible.
Yeah, it is.
So there's something else that you said. We were talking about the strength within, because that you were talking about core strength. And when people think of core strength, they're thinking of the washboard abs, the six pack, maybe that flat belly, suck that thing in and hold it. And that's not what you're talking about, because what you're talking about is much deeper than that, and it has a lot more flexibility and buoyancy even.
Yeah. So when I say core, I'm really referring to the deep lower core. Okay, so the diaphragm, which is considered mostly a breath muscle, which that's one of the things that, we discuss in initial treatment sessions, is your diaphragm. Yes, it helps you breathe, right? But it's also a major stability muscle for your body. And it's the relationship of diaphragm to pelvic floor isn't something that you can ignore. If that relationship isn't there, you're not going to have support. That's just kind of how it is, right? You're not going to have that support. So when I refer to core, I'm meaning diaphragm to pelvic floor, the deepest abdominal muscle, and your deepest layer of back muscles. When people see like the washboard tummy, right? That top muscle, that's your rectus abdominis. And oftentimes, so many times people come in with a flat tummy and a really awesome, six pack, which sometimes I'm jealous of, but their core is not functioning.
Right.
So just because you see that, just because you see this flat stomach, just because you see these washboard abs, does not mean that it's functioning. And flat tummy does not equal health. It really sometimes equals major dysfunction.
And weakness.
Yes, absolutely.
Even though it's a, sexy muscle and a sexy look, it's an external muscle.
Yep.
And that's what people are really focusing on because they're going for the look. And because we don't talk about the deep muscles, hopefully after this podcast, people start talking about it more, they get ignored. And if it's like, I tell people, it's like the foundation of a house.
Yes.
If you don't have that strong foundation, you start putting, bricks and mortar and stuff on it, that foundation is going to collapse. And that's one of the big things, even with the quote unquote aging process that I try and promote. It's not because you're getting older. It's just because you've ignored those muscles for so many years that the foundation is falling apart, but you can build it back up.
You totally can. If you think of that, the deep lower core, if you think of that as your support system, your foundation, right? That's what you want solid so that your arms and your legs, your outer abdominal muscles, your outer back muscles can move freely upon that. That's what we're going for. And it's not always that somebody is just so weak. If you were so weak, you'd be like falling over, right? Not that everybody's just falling down, right? But it's that re-education to the deeper support system. Like, hey, this is actually what you're made to do. This is how you were designed to work. It's like we're calling upon them to, get brought back to life a little bit so that we don't have to have all of this shoulder tension, hip tension, knee pain, all of that. We need a freely moving outer system.
I love what you said about the bringing it back to life because once you find that pelvic floor and those deep abdominal muscles, and I'm going to have you address that a little bit more, talk more deeply about that, it really gives you a sense of vitality and liveliness. And without it, it's just like this, I can barely, it's a lot harder to move. You can.
Yes. Well, and just that area of our body in general, right? If you have a bicep injury, you can see your bicep.
Yeah.
It's pretty easy to, you can touch it, you can see it. Other people can, really tell what's going on. The pelvic floor, you can't see it, right? It's not easily able to connect to. So we have to do a little bit deeper searching within ourselves to really find it and to truly connect with it. It's not just something that 100 crunches a day is going to fix. Right. There's a lot more to it. It means something deeper in our body. And we just have to be willing to find that connection.
Hence the word core.
Yes.
Because it really truly is in the center of our bodies. And again, people don't think that deeply, but we were having a conversation before we began recording, and we're talking about like young athletes, young female athletes in particular. So go ahead and talk about that, some of the problems with the young female athletes. So if you're a mom out there listening, and this does not only apply to athletics, as a dancer, trust me, it also applies to your young gymnasts and dancers.
Absolutely, yeah. So one of the things that really, every time I hear it, I just cringe is that pelvic floor issues don't affect young people or people without children, and pelvic floor dysfunction or the things that we're talking about is normal if you're aging, right? So those two things like really make me like mad, right? Because I see young people, I've treated young people, right? So we were discussing earlier, I had a client who was in high school, 17 years old, and losing control of her urinary function while she was running cross-country races. Now, if you think of that in terms of just alone from what she had to deal with after, I mean, it's crushing, right? And then secondly, okay, yes, it's super emotionally traumatic, right? But why? Like, this shouldn't be happening. And it's happening younger and younger. You mentioned gymnasts and dancers, and those two populations are hugely affected by all of this. But if you think about, in general, if we're referring to athletics here, if you think about in general, male athletics versus female athletics is still relatively new compared to male, right? So all of these sports, right, our bodies aren't really there in terms of like the evolutionary process to handle all of this increased force that we're putting, right? And then you add in that people are specializing in sports earlier. So we're starting athletics at a very young age, and then we pick a sport and we stick with it and we play it all year, and we don't give our body any time to cross-train and do other things. So the dancer is dancing all year round. The gymnast is going through hours of training every day, their whole adolescent life. Or a runner, right? You're pounding while you're running every day. And you're doing this on a body that's not progressed enough functionally, development-wise, right? And the pelvic floor can't keep up. It just can't. We're growing. And then you bring in the fact of, younger, we're going through puberty younger and younger. And that the causes of that are much more than what we're going to talk about today. There's a lot that goes into that. But when we go through puberty earlier, the structure of our body can't keep up. It just can't. And when we're not addressing it, we don't live in a natural world. We go to school at a young age, right? And we sit in chairs all day long. We're getting less and less recess time. We're just sitting. We're just sitting all day long. That does nothing to help our function. We're not squatting up and down like we used to. If we lived in a natural environment where we were squatting the way that our ancestors did, these pelvic floor dysfunctions probably wouldn't be occurring in our young girls.
Well, and then what you're saying too is as they're sitting, and we're sitting for hours and hours and hours at a time in school, the pelvic floor is actually atrophying while you're doing that. So they're getting weaker and weaker, and then you go out and you start doing all of that hardcore sports. And I think that the girls' sports programs are being mirrored after the boys' sports. So it's not even taking into consideration we're getting our periods, and it's not just, oh, you're menstruating, you have a flow. There's a lot more to it than that. And the hormones and the hormonal changes really affect a lot of the different muscles of our body. Our inner thighs are related to our hormone function. And then trying to do the exact same level of performance when your hormones are changing like that and those muscles are turning off because they have other things to do, you're really setting yourself up for incredible injury as well as injury to the pelvic floor.
Yes. And, it's funny. Well, it's awesome actually that you mentioned the hormone thing. Because then what gets done is you go see somebody because now you've got this period and you don't really know how to deal with it. And you're given things to cover up the symptoms.
Fantastic.
And instead of saying like, okay, I have my period, your period is a really good indication of how you're doing health-wise every month, right? So you get your period, you have these things happen, you have these symptoms that you don't like. I don't like them either, right?
Mine are over.
But we're given things to cover them up. Instead of saying, hey, you know what? Your body's telling you something right now.
Right.
You, in fact, shouldn't be having these symptoms, right? But we're just going to cover them up instead of getting to the root problem. So then you cover up all of these symptoms for these young girls who are still developing. So it further disconnects them from how they're growing. Like, they don't know their body. Pretty soon they're 25 and they don't know their body. They don't know what the heck has happened. They just know that they've now been on birth control for 10 years and they're going to try to get off it to have a baby. That's
a really important point about that lack of self-awareness and body awareness, because I would see that all the time when I still had my private practice. It's like, oh my God, how are you functioning? Because it's that disconnect. And I'm talking women of every age and a lot of the men too were the same way. But it was just, I think for women, we're kind of taught almost or encouraged to not pay attention to things like your period or just, keep on going.
Normal, right?
Well, it's normal, and of course, girls are supposed to hurt and all that kind of stuff. Oh, just drives me crazy. One thing you were talking about the relationship between the diaphragm and the pelvic floor. And can you talk about that a little bit as far as the movement of the breath and the movement of the pelvic floor to give people an idea, something that they could visualize?
So your diaphragm sits inside your rib cage, right? It's a dome-shaped muscle. Your pelvic floor is another kind of bowl, dome-shaped muscle.
Important to keep in mind. Remember that.
Yeah. So when you breathe in, air enters your lungs. Your lungs expand. Your rib cage expands, right? Your diaphragm, because of that, it kind of lowers and widens. Okay? So the dome kind of flattens out. Because of that, you've got all of these organs in your stomach area, right? So you've got all of these organs in your abdominal cavity, and so they kind of get moved down, right? Because the diaphragm is pushing them down. That's supposed to happen. If you're wearing a waist trainer, you're preventing that, so that's another thing. But
I'm going to write that down too.
So your organs, right, they're supposed to move. You were supposed to move our abdominal cavity, the contents of our abdominal cavity up and down, right? So that happens. The diaphragm kind of moves them down. Your pelvic floor has to respond because that's the bottom. That's the bottom of your torso. So your pelvic floor responds by doing the same thing. You think of it kind of lengthening and widening, okay, to allow for the contents of the stomach to move down. Now, when you breathe out, air leaves the lungs. The lungs get smaller. The diaphragm comes back up into the rib cage, kind of back into that dome shape. The contents of your abdominal cavity move back up to where they were. Your pelvic floor lifts. So if you think of that up and down movement, it's like a piston, right? So it's like moving up and down within you. That's the relationship you want to have. So bracing or sucking in, right? Like the waist trainer. I talked about the waist trainer, right? When you are preventing movement through your abdominal cavity in any way, tight pants, whatever it is, you're not getting that relationship, right? So you're creating dysfunction by trying to prevent breath into the belly to look like you have a flat stomach.
Right.
Yeah.
And it's even unintentional sometimes,
yes,
too. It's like,
absolutely.
okay, if my pants are tight enough, and it's like, well, I gotta like this because it's sucking it in. And, they even have certain clothing, jeans and stuff you can buy that'll really suck it in. Oh, Spanx are another one. I know some people that wear Spanx and I'm like, really, just enjoy it. Take the Spanx off and let everything hang out. It's okay.
And doesn't it feel so good when you take
it does
it off?
And you can breathe again. Isn't that fascinating?
Isn't that amazing?
It is amazing. And then as we're talking about this, we're laughing about it, but it is really kind of sad because I know in ballet class, we're taught, to knit those ribs together, and flatten your low back. Well, that's just not a functional spine. And even in Pilates, when I told you I started studying Pilates for myself in '83. And back then it was like, squeeze your butt together, flatten your back, suck in your stomach. And I was taking Pilates 3 times a week. And I was like, every morning, a Saturday morning ritual, before I went to ballet class, I would lift my nightshirt and look in the mirror to see if my butt got any smaller. And it's like, why is my butt getting bigger? My thighs getting bigger. My hamstrings are getting tighter. I wasn't a physical therapist at the time, and I wasn't a Pilates instructor back then. And then it's like, oh, mental head smack all these years later. No wonder. But that's the way we were taught. It was like the school of grip and tuck. So you are a Pilates instructor, and I know you went through the professional training. What was it, a year or so ago?
It started about 2 years ago.
Okay.
The professional training.
Okay. So talk about that, because there are ways of teaching not only Pilates, but even the physical therapy, rehab type of strengthening exercises. And it's not just, I don't want to just say Pilates and PT, but even yoga and so many other movement modalities out there that it's just like, you really got to pick and choose your instructors carefully and your school of what they believe in.
Yeah. When you mentioned the flattening of the back, right? If you look at a spine, or if you look at yourself standing, right? Your low back has a curve. Your upper back has a curve. Your neck has a curve, right? It was designed to be there. It's supposed to be there. And
a reason.
There's a reason for that, right? The way your muscles attach inside the body, right? They're meant to have the most efficiency if you're maintaining the spinal position that was designed to be there. So as soon as you flatten your back, you're taking the ability for the deep lower core to really support you. You're taking that out of the equation. And then what happens is you get that poof in your tummy, right? So your tummy puffs forward, and you do 1,000 crunches a day, and you don't get any abs, and you're really upset. But all you're doing is puffing everything forward, because you don't have, that's your rectus, that's that 6-pack muscle. It's bowstringing forward. That's what's happening. There's no support coming from underneath, right? So I always tell people that I'm super picky about who teaches me movement. And that's what we need to think of it as. The fitness world is not regulated, right? So if you haven't done the research on, okay, where did this person who's teaching me how to move my body, which is a pretty important thing if you want to be mobile into your, later years, right? If you're not looking at where they got their movement education and what kind of style they have or what their philosophy is on movement, and do they know what a neutral spine, neutral pelvis is, right? Can they bring me into my body? It's not the place. It's not the place for you. And unfortunately, it's not regulated, so we don't have a whole lot of control with who's out there teaching. But we can do better for ourselves by doing a little bit of the research and finding somebody who we can actually trust to move forward with that.
And if I can add just a little nugget there on top of that too, if you're working with somebody and your body doesn't start looking better and feeling better, you might, it's not you. It might be the way you're being taught.
Yeah.
Because there are a lot of people out there that think they know what they're doing.
Yes. Yeah. And, you know, speaking from a personal experience, right? Like I was always under the mindset of like, okay, as hard as you can, as fast as you can, for as long as you can, like you're dead at the end of your workout. And that means it was a great workout, right? But my body hated it. And it wasn't until I really realized, oh, okay, movement's supposed to feel good. Like what? That's how you should be feeling after workout. Like, yes, I still want to have a good sweat. Absolutely, 100%. I still want to push myself. But there's a difference between pushing yourself and still feeling good and pushing yourself to the point of pain just because it's the new cool workout to do.
Right. You know? Oh, that drives me crazy.
That doesn't mean that it's good for everybody.
Yeah.
You know?
Well, that just circles back to listen to your body.
Yeah.
Because our bodies are a lot smarter than our brains are sometimes, or it's not really, our brains are pretty smart. It's the self-talk.
Yes.
And, you know, what we pay attention to is, again, you're looking outside yourself. You're looking at the look. And, you know, once everybody else is doing it, so I should be doing it. Even though everybody else has all this pain and dysfunction, you know, that could be a clue too.
Yeah.
So you might want to take a look at the people who are going in and out as well. And how they're moving and how they're working.
Yeah, exactly.
So I wanted to ask you about a few other things too, because as far as the pelvic floor, and you know, it is related to everything, and you're doing such a beautiful job explaining that, and I love the visual of, you know, the relationship between the diaphragm and the pelvic floor. And one of the things that I've been seeing a lot, even before I stopped I closed my practice, and even now in the ballet world especially, and I'm seeing it now in runners, is there are an awful lot of labral tears in the hip.
Yes.
Yeah.
So,
is that a whole nother podcast?
It could be. But so here's kind of another little like personal nugget, right? So if you're curious on what I like to do in my spare time. So some of the people that I work with, we went and we did an extra cadaver study.
Oh, good for you.
You know, because that's what you do on a weekend.
I know. I mean, it's fun.
It was awesome. Yeah, I loved it. So, you know, when you look at the pelvis, so you've got the bony pelvis and the pelvic floor sits inside of that, right? So you can like touch your hip bones. There's your pelvis, right? So the pelvic floor is inside of that. Immediately on the other side of that, we have 6 hip muscles, right? They're deep, okay? And when you look at a model, or if you look in a book, you look at a picture, you can say, oh, they look really close. That's cool, right? But honestly, it wasn't until I literally had one finger pelvic floor, one finger on those hip muscles, you know, and you have gloves on, right? But but I could feel my nails through the muscles and through the gloves. So it's not, these muscles aren't big, bulky like your glutes, right? Think of them more as like thin and wider, right? They're not super thick, okay? So that being one thing, but that's how close they were, right? Like that's how intimately related they are. And again, going back to that outer system, if you don't have that deep lower core support, there's no way that your hips are going to be able to move through the range of motion that we're expecting them to move without compensating in some way. And unfortunately, the compensation usually turns into a labral injury or something of such nature.
Or maybe even a SI instability.
Yes, SI instability, low back pain, knee pain, and honestly anything, right? Like it travels down to your feet. If you think of how your feet are connected into the ground, if you draw a line from the middle of your foot, so think arch, right? Like I tell people, well, your pelvic floor is holding up your arch, and they think I'm
crazy,
wacky, but if you draw a line up the center of your leg, right? So arch up to the middle of your knee, and then from your knee to your pelvis, those are your adductors, right? Your adductors attach into your pubic bone, the front bone in your pelvis, right? and then right there's your pelvic floor. Like that's what's supporting us. So just because, it's inside the hips doesn't mean that it doesn't directly affect what's happening down the chain and up the chain. So having a pelvic floor dysfunction, like you said, hip pain, knee pain, any lower extremity pain, low back pain, upper back pain. Yeah.
I'm going to segue just for a moment because you mentioned the feet and grounding. And I told you before we were recording, I have a teacher and a mentor that is up in Boulder. Jane Persh is her name, everybody. She's wonderful, and I am going to have her on the show eventually. And I study with her, if on a good week, it's 4 times a week. Between doing ballet and something else that she does called embodied awareness conditioning. And so it's very, very functional, and it really focuses on the pelvic floor. And we work a lot on our feet as well. And just doing some of the muscles and working the toes and activating the feet and connecting with the floor in a way that is so amazing. And I had really bad bunions. I had on my right foot a hammer toe, Morton's neuroma on the bottom, of that right foot was such a mess. And my feet, I still have the bunions, but they are so much smaller.
Yep.
My feet are so much more malleable.
Yep.
Not quite cat paws yet, but we're working on it. And I even have the pictures to prove it.
Yeah.
And it's so funny because I could feel the difference when I work my toes. It's like, oh my gosh, when I move my little toe, my pinky toe this way, I can feel it all the way in my pelvic floor on the the same side. It's just phenomenal. So when you work in that level of awareness and you work that into your body, not only does your body function better, but you actually, knowledge is power, and you are empowered. If you have to go to a physical therapist or a physician, you know your body better and you can communicate what's going on a lot more clearly. So you are more in charge of your body, your health care, and what's going on and what's going to happen.
Yep. Plantar fasciitis.
Bingo.
Right? So many people, this is just an example of it's her feet. Why are you treating her hips? Right? So,
because they're not connected.
Plantar fasciitis, there's usually some kind of pelvic floor component going on. And it's one of the things that gets missed. And we try to put on all of these fancy shoes to try to help. But really, we should be taking... Now, not all of the time. Yes, there are instances where we need to have specific shoes and specific inserts and all of that, right? But in general, if we spent a little bit more time outside of shoes... So that our feet could actually move the way they were intended to move, probably wouldn't have so many plantar fasciitis. Think about when you go from winter to flip-flops, how many people okay, so I see a lot of people who, winter to flip-flops, they get a lot of plantar fasciitis, right? So we've taken our feet into these shoes during the winter, right, where they can't move, and now they're a little bit more free in a flip-flop, and they freak out, right?
Freaking out feet.
Yeah. Right? So there's that thing, right? But if we really look at the whole body, it's not just the feet that's causing plantar fasciitis. That's ridiculous.
Right.
Yeah.
So, and that's the important thing is to keep in mind is that we are a dynamic system. We are a series of parts. You just cannot divide the body into specific little parts because you can't even wiggle your finger without it impacting everything else in your body. And when you think of things in that way, then you start to see a lot more connections.
Absolutely. There's a lot, when, if you can see your bicep, right? But if you're lifting a weight and doing a, quote, bicep curl, right? It's not just your bicep working.
Right.
Right? And so a lot of times people get super focused on, okay, well, what muscle am I working? What muscle do I need to contract? Or where am I what muscle am I activating? And my response oftentimes is, well, all of them. Right? Because it's more than that.
Right.
It's so much more than that. And it's really cool when you can find that within yourself to know that it is more than that.
It is. It's that sense of discovery.
Yeah.
And learning your own body. And we are fascinating. And I have to laugh because I had one lady when I was teaching Feldenkrais classes because I am a Feldenkrais practitioner. And so I would teach Feldenkrais lessons at my office too. And one of my clients was so cute. She'd always walk in and she'd say, okay, what body part are we working on today? And I would just, like you said, cringe and just like, well, we're going to work on our entire bodies. Well, that's not really possible.
Yeah.
Okay, well, we'll just kind of get down on the floor and start to breathe, and we'll just see what we can find.
Yeah.
So what type of, let's go back. I want to circle back and talking about the Kegel exercises too, because you were talking about doing the abdominal exercises and the crunches and stuff, and you're just really building the strength of a protruding rectus abdominis. So you're building a muscle that's sticking out instead of sucking in, and you're really causing an awful lot of damage, not only to or harm to your pelvic floor, but your spine and and your neck as you're doing all of this. But we talked earlier about Kegels and how people are doing their Kegels, and will show me your Kegel. It's like, oh my God, you're doing it completely wrong. So they would actually be better off not doing the Kegels at all rather than doing them incorrectly.
Yes, absolutely. So I recently read an article that said that 100 Kegels a day was the magic number to have an awesome pelvic floor.
Yay.
It's not my favorite article, clearly, right? But the thing with a Kegel, most of the time, we're not doing them correctly. And having a pelvic floor dysfunction sometimes means that you have a whole... Okay, so to back up a little bit, you have a right side of the pelvic floor and a left side of the pelvic floor. Yes, they work together, right? But they also do some things independently of the other side. Okay. So if you have a pelvic floor where usually those sides are not the same. In fact, I've never seen a side that, or both sides are doing the exact same thing, right? Usually there's one side that maybe has a little bit more restriction, one side that maybe has less restriction, but maybe the timing is off on like the contraction piece of it. If you're doing a Kegel and your pelvic floor dysfunction, this is different for everybody because it's not all the same. We can't be lumped into one thing. If your dysfunction is such that there's a whole lot of restrictions, further tightening that muscle is going to create so much more dysfunction. Incontinence, so any leakage of urine could be just a little dribble. Oftentimes what people will tell me, oh, I don't have incontinence, I just have a couple dribbles, right? So incontinence means any leakage of urine that is not intended. Incontinence can be worsened by Kegels and it can be helped by a Kegel, right? There is a time and a place for a pelvic floor contraction. It's not just the squeeze that we think of. It's more about the lift of the pelvic floor. And just by understanding that, I think it shifts in people when they are learning about this stuff. But the only way to know if you're doing a Kegel correctly is to have somebody evaluate you internally to know what the muscles are doing. It's the only way. So if you have a practitioner who's telling you, I want you to do 5 Kegels, but they haven't felt what the muscles are doing, not something that we want to continue with. Okay. Right? So if you don't know if you're doing a Kegel correctly, it's super easy. You can come see me. We'll figure it out. And then, we can go from there. If you don't know if you're doing a Kegel correctly, it's best just not to do them because you could be creating something much worse.
That will be harder to fix in the long term.
Exactly. Yes.
So since you mentioned how you work and working internally, so that is something called the pelvic floor trigger point therapy. Is that what you do? Or
yeah. So sometimes, think of a trigger point as like being like a knot. And you have knots in your back, right? People can usually identify with those. So you can have those little restrictions in your pelvic floor as well. It's just like any other muscle, right? So trigger point therapy would be working on those specific restriction points, but sometimes it's if you think of like a fluid motion from side to side, right? Like you want fluidity from side to side. Sometimes it's more of a sweeping motion to figure out where things are at and how to connect them, if that kind of makes sense. So sometimes, yes, it's working out the trigger points. Sometimes it's just bringing awareness to the area. Internal work is done. It's not like going to your gynecologist, like your feet aren't up in crazy contraptions.
Yeah, right.
It's not that. It's really just a simple way to really actually, I shouldn't say simple. It's a way to actually feel what the muscles are doing. and to then go from there as far as what treatment is needed.
Right.
Yeah.
And I told you previously in another conversation that I actually had that work done for me because I was diagnosed with something called interstitial cystitis. And God, that was probably about 13, 14 years ago maybe. And I mean, I still can't even talk about it. It was such a nightmare. And, it just kept, it was, discomfort. And then it got worse and worse and worse to the point where it felt like I had a urinary tract infection, a bladder infection constantly. And I couldn't empty my bladder. So, it was the opposite of incontinence. And you haven't lived through hell, 100, 1,000 shades of hell until you cannot pee.
Yeah.
And, just a few drops would come out and I would just be moaning in pain. It was just horrible. And, I'd gone to the urologist, blah, blah, blah. And they put me on so many different medications, kept getting worse. So more and more medications until finally it's like, I'm a chemistry set.
Yep.
And I feel terrible. I was down to probably 118 pounds. I stopped getting on the scale after that because it was just horrible. Nauseated from the medication. And he's like, we'll give you something for the nausea. You'll be fine. And I was like, it was just such a nightmare. And out of desperation, I found somebody, I heard about this pelvic floor therapy, and there was a physical therapist not far from me, and I thought, oh my God, it's going to be intrusive, it's going to be horrible, it's going to be really hard to do this, but I was so desperate, I didn't have a choice, well, I didn't like the other choices that I had, and I was surprised how non-invasive and non-intrusive it really was, and even after the very first evaluation, the PT looked at me and said, I think we can help you. And I just lost it because it was like, oh my God, I've been living with this for over 2 years. My life was hell.
Yeah.
I was living a nightmare and everybody's patting me on the shoulder, telling me, oh, we'll just help you live with this.
Yes.
And what pissed me off more than anything is that I would be sitting in the urologist's office and right on his windowsill, there were some pamphlets about, advertising a physical therapist in town who specialized in pelvic floor dysfunction. He could have even said, here, I don't believe in this, but give it a try. But he didn't even give me that ray of hope.
Yeah.
I had to find it for myself.
Yeah.
So if anybody out there is dealing with something called interstitial cystitis, you do not have to take that lying down. So do you deal with clients with IC? And I'll just calm myself down because I'm giving myself a heck of a hot flash here and I don't think I have anything else I can take off. Okay, go ahead.
Yes, I do treat patients with interstitial cystitis. It's super frustrating. Another thing that just totally makes me super upset is because pelvic floor physical therapists, we're still not widely utilized. There's still a lot of medical doctors who don't believe in what we're doing because we are so used to giving medications. This is another area where it's like we're covering up something that our body is telling us. And if we would just scale back and ask our body to tell us what it needs, we wouldn't have to go that far, right? Part of the reason why I started Your Strength Within, and you'll see, if you read my blog, is I talk all the time about, I'm just going to talk about it, right? You guys don't want to talk about it, I'm going to talk about it, and I'm going to talk to everybody who will listen. I'm not shy about it. I don't care if I'm talking about your pelvic floor and you feel like I shouldn't, because it's probably involved, right? Yeah. It's something that we need to be comfortable doing, and if anybody is listening and you have interstitial cystitis, if you have incontinence, if you have any pelvic pain, abdominal pain, hip pain, pain with intercourse, it is not something you have to deal with. You are not alone. There's so many. If you took a poll of the women around you, because it's not something we even talk about with our close group of friends. Right. Because it's embarrassing, and it's, again, going back to that taboo, it's just hush hush, right? We're ladies and we're not supposed to talk about that. So I will, but
no one ever called you a lady.
Yeah, exactly. But if we just opened the door for conversation, and if you now, hopefully, you're listening, you're educated that this is out there, now you can talk to your doctor and say, hey, I heard about this physical therapy thing. Right. Put it in their ear. Start talking about it. Our profession, the PT profession, is trying, we can only do so much, right? We're trying to educate people on what pelvic floor PT is, but not everybody listens. And one of my hopes is that one day a pelvic floor PT is just on every single woman's healthcare team. Mm-hmm. Whatever your healthcare team looks like, you know, a pelvic PT is part of it. Every single teenage girl, once they have their period, once they have intercourse, once you are at that point in your life, you should know what your pelvic floor is and you should know how to care for it. Mm-hmm. And it should be something that's normal to educate on and normal to talk about. Just it should be normal because it's so important. Mm-hmm. It's kind of brushed off as not important a lot because we are brushed to the side, or we're given those medications, right? We're given the medications and told that we have to just live with it. You know, it's just a thing.
And there's another thing that, I know with me, well, I did have an incident that kind of like triggered the IC. I had a lot of soft tissue damage from an unfortunate incident that I've talked about before on the podcast. But even without that, previous incident, the first thing when you complain about pain, because I've had pelvic pain most of my life, found out, when I was 47, I had adenomyosis. So, and then when they finally figured it out, it's like, oh my God, we have to do a hysterectomy. And I'm like, hold the phone. Does this make me predisposed for cancer?
Yeah.
Oh, no, not at all. And I'm like, well, will menopause take care of it once I stop having periods? And, oh yeah, if you can wait that long, it's like, I'm 47. Mm-hmm. I've been complaining about this since I was 23. I think I can wait a few more years. And then, my doctor says, well, we'll just have to talk pain control. It's like, well, it's about time, but, it's just like kind of craziness.
Yeah.
That how people are brushed to the side. And I was told when I was young and complaining about all this pain and the pelvic pain that, there was something in my past, or I had to go home and search my memory. And just so demeaning and demoralizing and disrespectful.
Well, you're emotional and crazy, right?
Oh, yeah, well, I'm not emotional. I don't do emotions. People who listen to my podcast know, no emotions. I don't do emotions. But crazy, I will
But
give you
women
that.
in general, right, are emotional and crazy.
Because what was the... like hysterectomy and it was based on like hysteria because they used to call women, we're hysterical all the time.
Yep.
Yeah, well, you ought to see me on a bad day when I've got my sword out. You're not going to call me hysterical then. You'll just say, yes, ma'am. So, Ashley, tell us again the name of your business.
So, Your Strength Within.
And how can people find you? Because I think that every woman should read your blog. And maybe some men, too.
Yeah, maybe some men, too.
Hey, and how about gynecologists out there, too, and urologists?
So, yourstrengthwithin.com. Mm-hmm. I'm on Instagram and Facebook. So, Facebook, Ashley DPT. Okay. And Instagram, Ashley DPT.
Okay, and we will have those listed for you, too, on the podcast. Yep. So, okay, is there anything else that I've forgotten? I don't know. What do you think?
No, honestly, my hope, like I said this earlier, right? But my hope is just to let people, my hope is that people will know after listening to this that they aren't alone, right? It's not ever normal to pee your pants unless there's like a really significant neurological condition happening or injury. You can get help. And
you're not alone.
You're not. There's people there to support you. It's unfortunate that we've gone so long without having the people around us to support us, but it's possible. And, I got you if you need me.
All right. She's got your back, and she's got your pelvic floor. And it's great. But, I think this is so important. And that's one of the reasons why I wanted to do the FemiNinja podcast, is to help empower women. And that's a lot of it is education and letting them know what their options are, and that they don't have to suffer. They don't have to suffer in silence. So, ladies, our health is actually our own responsibility. And there are so many things that we can do to keep ourselves really healthy and functional all the way through, our 20s, 30s, 40s, 50s, 60s, 70s, and beyond. And that's just what we need to do for ourselves. So give Ashley's, check out her blog. I can't wait to read it myself. And once again, thank you so much for listening. As always, I would appreciate your comments, your input, your questions, anything. And remember, your pelvic floor and pelvic floor health is very important. And that's a wrap on another episode of the FemiNinja Project. Thank you so much for listening. And remember, be safe, be strong, and until next time, Bye now.